Welcome to The Explainer. Today, we are diving deep into the world of anti-inflammatory and anti-arthritis drugs. We're going to cover how they work, why they work, and most importantly, what you absolutely need to know to be successful in your clinicals and on your exams.
So let's start with a situation you might actually face. Take a second and really think about it. What's your gut reaction here? This is a super high-stakes scenario, and your first move is critical. Don't worry, we'll come back to this and break down the right answer before we wrap up.
All right, here's our game plan. First, we'll look at the body's natural alarm system, inflammation. Then we'll march through the drugs we use to control it, starting with the everyday NSAIDs, clarifying the deal with acetaminophen, and then getting into the heavy hitters, the DMARDs. We'll also make a pit stop to talk about gout and finish up with some must-know clinical pearls.
First things first. Before we can talk about the drugs, we have to understand the battlefield. What exactly is this inflammatory response that we're trying to fight?
At its core, this response is a good thing. It's your body's built-in defense system. Its job is to get rid of whatever is causing the problem, clean up the damaged cells, and start the healing process. But, and this is a big but, when it goes on for too long or gets way out of control, the defense system itself starts causing damage.
So what's really happening here? It's like a chain reaction. It all starts with an injury. Your body then sounds the alarm by releasing chemicals, like prostaglandins. That alarm causes the blood vessels to widen, that's your heat and redness, and become leaky, which lets immune cells rush in, and that's what causes the swelling. And this cascade is exactly where our drugs are going to step in.
Okay, so how do we quiet down that alarm? Well, our first line of defense is a class of drugs I guarantee you've heard of, the NSAIDs. Your patients will be taking these all the time. To really get NSAIDs, you have to understand these two enzymes, COX-1 and COX-2. Think of COX-1 as the good guy enzyme. It's always on, kind of like a housekeeper, protecting your stomach lining and helping your blood clot properly. COX-2, on the other hand, is the one that shows up when there's an injury. It's the main driver behind the pain and fever of inflammation.
And this is where the rubber meets the road. Most common NSAIDs, like ibuprofen and ketorolac, are what we call non-selective. They block both COX-1 and COX-2. That's why they're great for pain, but it's also why they carry that big risk of GI bleeds and kidney problems, because they're blocking the good housekeeper, COX-1. And pay close attention to ketorolac. The risk to the kidneys is so high that its use is strictly limited to 5 days max.
So because we're knocking out that protective COX-1, you have to be constantly on the lookout for these major issues. Everyone knows about GI bleeds, but please don't forget about the kidneys. NSAIDs can seriously reduce blood flow to the kidneys, which can lead to acute kidney injury. And notice that last point. They can actually make some blood pressure meds like beta blockers less effective. That's a huge deal.
This scenario is exactly why patient education is so incredibly important. A patient might just brush this off, thinking it's nothing, but you know better. You know that those black, tarry stools, melena, are a screaming red flag for a GI bleed. It is your job to make sure they understand this isn't something to wait on, it needs immediate attention.
All right, let's take a quick time out to clear something up that trips a lot of people up. People often group acetaminophen right in there with NSAIDs, but they are totally different beasts, and knowing the difference is crucial for keeping patients safe.
Here it is, the single most important takeaway on this slide. Acetaminophen has no significant anti-inflammatory effect. Zero. It's awesome for pain and fever because it works in the brain, on the body's thermostat. But its biggest danger isn't to the stomach or the kidneys. It's to the liver. This is a life or death distinction.
You have got to commit this number to memory. 4,000 milligrams, 4 grams. That is the absolute maximum daily dose of acetaminophen for a healthy adult. Going over that can cause devastating liver failure. And the scary part? Acetaminophen is hidden in hundreds of over-the-counter cold and flu products, so it's shockingly easy for people to overdose by accident.
So far, we've been talking about managing symptoms. But what do you do for chronic diseases like rheumatoid arthritis, where the body is in a state of constant attack? For that, we need to bring in the long-term strategists, the DMARDs.
See, unlike NSAIDs, which just clean up the mess inflammation leaves behind, DMARDs go after the source of the fire. In autoimmune diseases, that fire is the immune system itself. DMARDs actually change the course of the disease, and if you start them early enough, they can prevent the crippling joint damage we used to see.
TNF blockers, like etanercept, are a really powerful type of DMARD. They work by blocking a chemical called tumor necrosis factor, which is a major player in driving the inflammation in RA. The results can be amazing. But, and this is a huge but, there's a serious trade-off. You're intentionally suppressing the immune system, which leaves the patient wide open to serious infections. That's why we have to screen for things like TB before starting, and why you can't give these drugs to someone with an active infection. It is absolutely vital to teach these patients that they are now immunocompromised and cannot get live vaccines.
Okay, let's switch gears and focus on a very specific and notoriously painful type of inflammatory arthritis, gout.
The problem here is pretty straightforward. When you have too much uric acid floating around in your blood, it can't stay dissolved. So it turns into these microscopic, needle-sharp crystals that settle in your joints. Your body sees these crystals and freaks out, launching a massive inflammatory attack. That's what causes the sudden, excruciating pain of a gout flare.
So our treatment strategy has two parts. Think of it like this. For an acute flare-up, you need a fire extinguisher. That's colchicine. It stops the immune cells from rushing to the joint and making things worse. But for long-term control, you need a fire prevention system. That's allopurinol. It actually blocks the production of uric acid in the first place, preventing those crystals from ever forming.
All right, let's lock it all in. We're going to do a rapid-fire review of the absolute non-negotiable things you need to know. These are the concepts that will save lives in practice and save you on your exams.
And here it is, the answer to that question from the very beginning. A pale, pulseless limb in a cast is a sign of compartment syndrome. This is a true surgical emergency. Swelling is cutting off blood flow and the tissue is dying. Elevating the leg will only make it worse by reducing blood flow even more. The only priority is to get that pressure off, right now. Your job is to recognize it and get that cast removed immediately.
Listen up. If your patient taking aspirin tells you they have ringing in their ears, that's tinnitus. It is a massive red flag. It's not just a minor side effect. It is a classic early sign of aspirin toxicity. That's your cue that their levels are too high and you need to intervene before things get much worse.
This is one of those rules in nursing that is just set in stone. You never give aspirin to a child who has a virus like the flu. It's linked to Ray's syndrome, a rare but potentially fatal condition that causes massive swelling in the brain and liver. For fever in kids, the answer is acetaminophen or ibuprofen. Never, ever aspirin.
And that brings us to the biggest question of all. The fact that anyone can walk into a store and buy bottles of these powerful drugs creates a huge potential for harm. So what's our role? Our most powerful tool is education. By sharing what you know, you empower your patients to take care of themselves safely. In the end, your knowledge becomes their protection.